I'd like to welcome you all to our special Heart Health Talk session. Thank you for all joining us today to discuss an important topic that affects millions of people worldwide. Today on the session, our focus is on the importance of understanding and managing heart health for a healthier life. Today's webinar is organized by Seva at Home, our esteemed wellness partner. On the call, we have Mr. Atul Kishore, who is Chief Business Officer, and Nishu Arora, who is VP of Operations. Without further ado, I would like to hand it over to Mr. Atul Kishore.
Thank you, Sujita. It's a great pleasure to be here amongst futurist colleagues, friends across the country, and on a topic which is extremely important. This is on heart health. We've seen a spate of young deaths in recent times, and post-COVID, people have become more and more aware of the fact that they have to take care of their heart. And we have for you this evening a very eminent personality, very senior doctor, Dr. Anand Kumar Pandey. He's a senior director, cardiology,
Good evening.
Max Super Specialty Hospital, Vaishali, Ghaziabad. So welcome, Dr. Sir. And it's such a pleasure to have you once again.
Hello.
We've heard you before, and for those who haven't, let me tell you that the doctor is a very, very good speaker. He has very keen interest in wellness. And Dr. Anand Kumar Pandey is a DM in cardiology from LPS Institute of Cardiology in Kanpur, before which he had done his MD from LLRM College, Meerut. He has fellowships to his credit. He's a fellow European Society of Cardiology. He's a fellow American College of Cardiology. He's a fellow Cardiological Society of India. He's a fellow Society of Cardiac Angiography and Interventional Cardiology. And he's a fellow Indian College of Cardiology. His immense experience in hospital like Metro Hospital, Fort Hospital, Max Hospital. And he's been in the industry now for a long time, serving a lot of patients. Dr. Pandey has helped in establishing various non-invasive cardiac labs and CCU setups in Eastern and Western UP. He's also helped in establishing various invasive cardiac cath labs in many cities. And so once again, Doctor, very warm welcome to you. And half an hour, 25 minutes, and then it'll be open to all questions in the chat box. We can read them from there, or you can unmute yourself and ask the question.
Right.
So over to you, Doctor.
Good evening, Mr. Kishore. I think I'm lucky to be with you once again within a short span of time. Thanks, Nishu, for adding me in this wonderful group and audience. So I think somebody would like to share the slides so that I can go with the content. And anybody can interrupt if wants to know or want to ask something. I think most welcome. So I think slide can be on main screen, and then I don't know. So I'm very poor in technology. I don't know what to do. How to get the slide on main screen? And
so the slide is visible. Sujita, can you confirm?
Yeah. Okay.
Yes, it is. I can see the slide.
Okay. So I think that's fine.
Yeah, it says what is health. Yeah.
So if you can give me the control so that I can change the slide as per my convenience.
Can you do that?
No. Either he has to hear, then.
Just alert us, we will be changing it for you. Is that okay?
So I can change the slides from my side, or I can ask you to change, no problem.
You can just ask us to change, because the person who is presenting can have the control over the movements of the slide.
Okay, okay. So good evening once again, and it's a warm welcome from my end also to all the listeners who have joined me. And why, despite doing angiogram, angioplasties, I think I'm totally into interventions, but I realized that there's no match to your lifestyle. And lifestyle doesn't mean that you live with a five-star lifestyle. Lifestyle is good structured life. And if you go back to the health, what health exactly mean is the definition is almost 40-year-old when which still stands true. And the definition of WHO, what health is basically, it's a good state of complete physical, what you call as bodily strength, a mental, that is emotional and psychological well-being. In fact, one more word has been added in this new classification is physical, mental, social, and emotional well-being. And when I say mental means emotional, psychological well-being, and social means having very good relationship with everybody around, including family members, neighbors, your work pressure, peer group, the organization you're working. So I think that is what is the definition, which still stands tall. And I remember during COVID days, it was the dialogue was social distancing, which I said should be physical distancing and social connect. And this is how the COVID, that the crisis was tied over by socially connected and physical distance between the people around. So this background, I'll just share some new changes which I have seen in cardiology practice in last 4 decades. That there has been absolute shift of disease from very old age to younger age group. Now, WHO statistics in our Indian statistics also say that 50% patients which we see as heart disease or cardiovascular disease are before 50 years and one third are before 40 years. And youngest patient which I have seen in my career was a 19-year-old boy who was preparing for, I think, CAT. So I think the disease has really taken a huge toll on younger population. And again, because 25% or almost 30% of Indians are hypertensive, 10 to 12% of adult beyond 18 years are diabetic. There is 80% population, adult population has some or other form of lipid disorder. So they are three silent killers, and I think that is the reason that we are getting so much of CVD, cardiovascular disease. And when I say cardiovascular disease, means it's a cardiac disease, and it's a brain disease, that is stroke and kidney, and of course peripheral supplies of lower limb and upper limb arteries, what is called peripheral vascular disease. So this all together are known as cardiovascular disease. The risk factors have been almost same for every disease process. Next slide, please. Next. And see, there is always a confusion that what is wellness and what is health. And yeah, please focus here. So wellness is basically, health is a part of wellness. You can go to next slide. So wellness is a very broad term and health is a part of that. And when I say wellness, it's a very dynamic process. It is not a one-day achievement. Wellness means as long as you live, you have to have a dynamic process of being in a good health and wellness. And I say there are 6 dimensions of wellness. That is physical wellness, that is I've said, emotional wellness, intellectual wellness, spiritual wellness, interpersonal wellness, and environmental wellness. Look at the latest WHO data that urban Indian adults are almost losing 2 to 3 years of life just because of pollution. So that is what is environmental wellness, and every domain has its importance. And as a doctor, we strongly feel that these all 6 in the right combination are going to give the best possible complete health solutions. Next slide. So there have been certain major conventional risk factors which have been for last many decades, which still stand true, is a premature heart disease. And when I say premature heart disease means heart disease in males or first degree male related before 55, and females are first degree female related before 65. So if somebody's parents had heart disease at the age of 75, 80, it's not a positive family history. But yes, A father had heart disease before 50, or mother had heart disease before 60, 60, 55, or first degree relatives had premature CAD, I think the individual has a very right genetic background for getting heart disease. Look at the basic disease process. Mendelian hypothesis says that there are only two reasons for getting disease. One is a genetic background, and other is lifestyle. The rest all is what you basically nurture a gene by your faulty lifestyles. So there are two reasons. One is bad genes and bad lifestyle. So you can modify genetic background by having good quality life. Like many patients come that father and mother had heart disease or brother had diabetes, but because of my lifestyle, walk, physical, yoga, meditation, pranayam, good diet, I am not diabetic. So you can change your genetic background by a good lifestyle, or you can derange your genetic background by faulty lifestyle. So there is a very huge role of a conscious decision in day-to-day living. The cigarette smoking, any tobacco or smoking in any form is not good. India's largest hub for oral cancer just because of chewing tobacco. And dyslipidemia, as I told earlier, elevated LDL cholesterol or low HDL cholesterol, hypertension, and diabetes. So I'll just tell the numbers here. So if somebody is diabetic, then a good control of diabetes means the HbA1c should be around 6.5, never more than 7. Blood pressure should be less than 140/90. Or if diabetic or has a kidney disease or having some stroke, neuro issue, then it should be less than 130/80. Your total cholesterol should be less than 180 or less than 200 maximum. LDL should be less than 100. If no disease, if there is heart disease, then it should be as low as possible. To bring up residual cholesterol, not much drugs are there, but good quality physical endurance exercises, jogging, cycling, skiing, all these bring up your good cholesterol. Cigarette smoking, absolute no to tobacco in any form. And then this is what is the family history. Next slide. Obesity is another risk factor. And I see India is facing a paradox of, on one hand, there is a malnutrition. On other hand, there is overnutrition. So look at the diet, what the fault with the diet is. Like we are having high calorie and poor nutritious diet. The things should have been reversed, a good nutritious and low calorie diet. But our diet is too much with calories and too much with trans fats, which are very unhealthy fats. So obesity is really epidemic, and that is a reason that Indian urban, one third of kids are obese, and unhealthy kid grows into unhealthy adult. And there is a very good saying that obesity runs in the family because nobody runs in the family. There have been a lot of, I think, two-liners about pizza and burgers that 2 minutes for 2 minutes on the lips and then whole life on the hips. So I think this faulty lifestyle is really killing the people left, right. So obesity is one, and then physical inactivity. So majority of people I have seen have very sedentary lifestyle. Uh, Getting late in the morning, then driving, reckless driving, you can see road rage and hurry, curry, worry, anger, frustration, anxiety. All this you can see on the road every day. So sitting in the office, then sitting in a natural light, then coming late in the evening, having the worst, most heavy meal as a dinner. So the whole lifestyle becomes a faulty. So physical exertion is hardly any. So what I say that you should avail every opportunity to walk. And that's why WHO has said that 10,000 steps a day, which can be in bits and pieces. So like going to second floor, third floor, you should use a staircase. Surface walking, as much as you can walk, you should walk. Next slide. Next, please. So, and see these four factors which have been, they have not been classified as conventional risk factors, but a lot of buzz is there, like pollution, as I told earlier, then plastics, then pesticides and preservatives. These four P's are really, I think they are real health hazards. And I was talking to a very literate patient. Ki, Doctor, Sahab, people go to a mall and look at the expiry date of food items. और जितना लंबा expiry date होता है उतना ज़्यादा उसको खरीदने की कोशिश करते हैं. So there was an article, more is the expiry date of food items, less is expiry date of yours. Because if you have to preserve some food for months together, you have to have preservatives. So what I mean that go for as far as possible having natural, fresh fruits, juices, and the low-fat dairy products and vegetables. Don't go for canned and preserved foods. So pesticide is again used for, I think, having more yield, and plastic. There was a research, there was a public data, I mean, there was a article in journal from Italy that the patient who had a stroke, and when they had a surgery, like they had a carotid artery surgery, the artery supplies to brain. And when they removed the particle which is causing a stroke, on MRI and electron microscopy, they could see the plastic nanoparticles in their arteries. So plastics, there are plastics in urine samples, there are plastic in blood cells. So I think plastic has invaded every part of life, and all these 4 P's are, I think, and we can minimize this, all these things. There is no science, there is no rocket science in minimizing all these things. Next slide. So this is very good pie diagram where you look at the, suppose somebody has to live for 77.9, that is 78 years of age, and he's 66.2 years he's healthy, and almost 11.7 to 12 years is unhealthy. So the beauty of wellness, such program of wellness program is that we should reduce this part and increase the yellow one. So more and more life, you should look healthy. Next slide. So diabetes, I said, diabetes, you can change these slides. You can go next slide. India is having the maximum number of diabetics in the world. Next slide, please. Next. Can you, yeah, please, next slide. Next. Keep changing. I'll just stop when I want to. Yeah, go back to previous slide. Go back to previous one. Previous slide. Yeah. So as I told you earlier, blood pressure, sugar, and lipids are very important ingredients. So this is something a very good slide. See, it is almost still holds true. This slide was in 2013 and it still holds true. The same, it hasn't changed in last, can say, almost more than a decade. So weight loss, maintaining good body weight. By a simple 1 millimeter mercury loss of weight, you can bring down 1.2 to 1.3 millimeter mercury. So suppose you lose 10 kg weight, you will be losing almost 20 millimeter mercury blood pressure. So if you're mild hypertensive, by maintaining good weight, you can bring down your blood pressure. DASH eating plan is, what is that? It's a dietary advices to stop hypertension. And what is the diet? Is a diet rich in fruits, vegetables, low-fat dairy products, and reduced content of saturated fat and total fat. So I'll point out important point here that when we say fat, so I divide fat into two. One is the natural fat and one is the industrially driven, industrially manufactured fat, and what you call as trans fat. That is mayonnaise, pasta, pizza, burger, patty. All these are trans fats. So good quality fat is like butter, little bit of butter, little bit of desi ghee, paneer. They are all very good quality fat. So such diet can bring down the blood pressure by another 8 to 14 millimeter mercury. Then reducing the dietary sodium, another 2 to 8 millimeter mercury. So less than 2.4 gram or less than 6 gram, a small teaspoonful in 24 hours. And I think majority of us consume more because hidden sodium is it is not only cooking salt, then there is a papad, then achar, then salad, then chash, then chutney. So everywhere the salt is loaded. So I think we have to have very judicious use of salt because we are very salt sensitive. Then physical activity, at least 30 minutes of brisk walk every day, or 5 days a week, or maybe more than that. So more additional is going to give you a better quality of life. Alcohol. So there is no therapeutic role of alcohol. That if somebody doesn't drink, should advise to start alcohol. But those who take alcohol should restrict less than 60 ml a day, maybe twice a week, or less than 30 ml for females. And abstinence is preferred. See, problem is not with alcohol. The problem is the snacking which Indians do with alcohol. Like, look at the such high calorie snacks with alcohol. So I think that is worse. And alcohol has been labeled as a commonest cause of reversible hypertension. So if you reduce alcohol intake almost to negligible amount, you will still be losing blood pressure by 4 millimeter, and tobacco to abstinence. So if you combine these four, you can reverse your disease process. Just by, so that is the beauty of lifestyle. Next slide. Next, you can go ahead. Yeah. So again, good health, physical health, the definition I'll go by good body health, by which is results of regular exercise, proper diet, nutrition, and proper rest. So when I say proper rest means a good quality sleep. So there was a very famous CEO, was one of the fittest CEO in India, and he had a sudden cardiac arrest at the age of 40 years. And when people are shocked to know his this news, but when the people went for detailing about what was the reason for such a healthy man to have sudden cardiac death, and they found he was not sleeping more than 4 hours a day. So it is not the sleep duration, which is 6 to 8 hours, it is at quality of sleep also. So sound sleep, a quality of sleep, 6 to 8 hours sleep. There has been very good data recent published that a half an hour power nap, that is mid-afternoon nap, is as good as a 4-hour sleep of the night. So what I mean that one should always take a proper rest, because that is the only time when you recover from all the traumas, whether physical, emotional, mental, or any trauma. Next slide. So WHO says that 80% disease is psychosomatic. That is, they start from the mindset and then they affect the body organs. So a good mindset is going to have the best quality of, I think, physical health. Next slide. Next. So work-life balance is very important. So I'll here narrate about good blood pressure, good sugar, good body weight, good lipid profile, 8 hours sleep, avoiding prolonged sitting more than 60 to 90 minutes in one stretch, I think is as a disease. Then lack of water intake. You should minimum take 2.5 to 3 liters of water in 24 hours unless doctor has restricted because of some kidney issues or because of some heart issues. Otherwise, water is the best source of lubrication and best source for kidney and heart functions. So I'm taking break because we work to live. We do not work to die. So when you feel you need a break, you must take a break. There is no point that working relentlessly to have a breakdown at one day. Next slide. So work-life balance is very important, which everyone should achieve. So next slide. Next. So see, this is the slides from Upanishads. The food alone is the best medicine for. See, earlier I don't know whether the medical science I think must be fully evolved than what we have today. But food was one of the main ingredient of good health. The food alone was the best medicine for all living creature. And a French proverb is that a good meal ought to begin with the hunger. It is not the availability of food which makes you to eat, rather than you should feel hungry to eat. So I think that is a very important message. We should never indulge in binge eating and eating whenever food is available. And mind it, your breakfast should be the best meal by all default. Next slide. So this is something very important. Elimination to facilitate your natural body cycle. Elimination of food is from 4 a.m. to 12 noon. Appropriation is from 12 noon to 8 p.m. and assimilation is from 8. So what I mean to say that every food item has a different clearing time. Fruits and fruit juices 30 minutes, salads and raw vegetable 2 hours, properly combined veg meal 3 hours, properly combined non-veg meal 4 hours. Any improperly combined meal will take 8 hours. That's why one should never mix the fruits and food. And because whole body system will be confused how to digest a vegetarian diet, how to digest non-vegetarian diet. So one should never mix different kinds of food together. And result of non-felicitating a natural body cycle is calmness is stomach disorder like acidity, gas, constipation, and obesity. So it is not the type of food, it is when you eat, where you eat, what you eat, how you eat, and how much you eat is, I think, what is very important. Next slide. Next slide, please. You can go to next. Yeah. So your figure mimics your dietary pattern. So a light breakfast, a working lunch, and heavy dinner. Reverse it, a heavy breakfast, moderate lunch, and very light dinner. And it's very science is there about this. When you do very heavy dinner and then you go to bed, the food clearance goes very slow. Contrary, if you have a very heavy breakfast and lunch, you are working, you are moving around, your food clearance from oral cavity down the stomach is very fast. But now, if you have a heavy dinner or you become horizontal, the food clearance is going to be very, very slow. So, if you eat 4 chapatis in breakfast and 1 chapati in dinner, it is as good as 4 chapati breakfast. So, that is why fruits, your breakfast should be the best meal. Next slide. Next. Yeah, so you can see how the French fries have grown. Earlier they were 200 calories, now they are 610 calories. To burn 400 calories, you have to walk for 2 hours and 20 minutes. So it is better not to eat rather than to punish yourself after having French fry. Next slide. Next slide. So balanced diet, see, there are certain times people are confused. A good diet can be taken in a large amount, but balanced diet should be balanced. You should not eat even the best quality diet in a high amount because ultimately you're consuming the calories. So calorie restriction, if you want to lose weight, you want to be fit, the best way is to maintain body weight is a calorie restriction because how much exercise you are going to do to reduce the weight. So why exercise then? Exercise is there to tone the body, to increase your BMR, basal metabolic rate, so that the digestive process is very fast and brisk. So calorie restriction and a good quality diet in a balanced diet is really going to have a good body weight. Next slide. So this is something very unhealthy diet. Look at all trans fat from top to bottom. And this one burger is almost 1200 calories. It is almost a 2 meal. Calorie of 2 meal is having in this one burger. That too is very unhealthy. All these mayonnaise and I think trans fats. Next slide. Next, please. Next. So fast food is like I think is as bad as smoking 2 cigarettes. So it is as bad as smoking the fast food. That's why people say it's junk. So junk means basically useless food. Fast food is, I think, one of the biggest killer of, I think, younger generations. Next slide. Can you go to next? Next slide. So very important is that people always ask about which oil they should have. So it is your choice. You can have any oil, whichever you like actually. because hardly you consume 5 to 10 ml of oil. So oil should be, well, there is no obsession for olive or safflower, sunflower, mustard, whatever oil you like, because I find they're just a very small amount of cooking medium, and food should be palatable and food should good to taste also. So to maintain palatability of diet, there are certain allowances of quality of oil which you want, quality of desi ghee you want to use some good quality butter, paneer. I think otherwise you will not maintain a good quality food for long term. Nuts are very good, and I think almonds are one of the best, and walnuts because they are very rich in nutrition. They are okay in calories, and they are very fast supply of I think calories with a lot of antioxidants. And when I say antioxidant means why there is so much call about antioxidants. So what do they do actually? Antioxidants are basically a material which prevent oxidation of LDL, bad cholesterol. So unless the bad cholesterol is oxidized, it will not be deposited. So to prevent deposition of bad cholesterol, you need a good antioxidants in diet, and that is all natural fruits and vegetables. So that's why if you are consuming such diet, even if LDL is high, bad cholesterol, it is not going to be deposited because it will not get oxidized. So that's why the beauty of antioxidant is. Next slide. So I think uh, there will be a lot of slides, and I think I can take question answers if you permit.
Yeah, I think so. That will be better, Doctor.
Yeah.
I think
Sure, sure.
so.
First of all, thank you so much, Doctor, for providing such valuable insights. If anybody has any questions, please feel free to drop it on the chat box, or you can unmute and speak.
So, thank you, Dr. Pandey, for having this wonderful
Thank you.
presentation. So, one thing we just want to know, like we are talking about the balanced diet, healthy lifestyle, but with lot of work pressure, stress related to the work-life balance. If we say this, long working hours, family responsibilities.
Yeah.
See, we are not, and definitely our food culture, Indian food culture, also you specify that we are eating a lot of oily food and all. Our taste buds are developed in that manner. How we can, how we can adopt the healthy lifestyle as you described, and matching to our busy schedule at workplace and uh, with the family, and
Yeah,
maintaining
very
our
right.
culture.
See, very right. See, there are certain things which you don't require. I have said, I have heard a lot. I don't get time. Look at to get up in the morning, to walk for 30 minutes, to have a 6 hour sleep, 8 hours sleep, to have a good, 2 to 3 liters of water, to have your breakfast, lunch, and dinner on time. Where do you need time actually? So it is basically mismanagement and mindset. I have seen people having their lunch at 6 when they finish their OPD and then their day. So can't you afford 10 minutes to have your lunch at lunchtime? Do you need to have extra time to have a glass of water? So it is basically the mindset which I think is killing us more than the paucity of time. And Japanese has been awarded Nobel Prize 3 years back for biological clock, which has been circadian rhythm. That after sunset, there is a gland called pineal gland, which is activated and releases melatonin, and which makes you to sleep, natural sleep. And now people are using melatonin to have a natural sleep by artificial means. I think whole culture has to be evolved, and this should be from a school going child to have a structured lifestyle. See, it is a wellness which is a dynamic process. It is not a one-day job. Just suddenly you realize from tomorrow you have to have good quality of life. And one has to define what do you need, because majority of time people create artificial crisis and live in that. I think for all these things, we don't need time. If I have to be here for half an hour, I know in the morning that I have to wind up my OPD by 3:34. I have to reach my home by 5 o'clock. I will have a cup of tea. I'll sit for half an hour, 45 minutes, 1 hour with all of you. See, this is what is my mental health. I don't know how much you are going to gain, but when I interact with people and understand the problems, then I realize the best way to have a good health is to interact with the people. So social media is again, I think people are very social on social media, but the connect is missing. So all these things, small things, I think if we incorporate, basically you don't need time for all these things. It is already there. It is a mismanagement which I think is more important to be taken care of rather than you require extra timing. And good diet, and I think as you look at the diet of your grandparents and parents, I think that is a diet which we want to go back.
I agree with you, doctor. I couldn't agree with you more. It's about discipline. It's we all have
Yes.
24 hours.
Yeah.
And whether you have lunch at 1:30 in the afternoon, which is the right time to have lunch, or at 6 o'clock in the evening, it's going to take the same amount of time.
See, yeah, very right. So where do you need time to have a glass of water? You don't need to have extra time for that. You have to, people see mobile 12 o'clock, you look at the mobile, 1:30 minutes when you get a message. We have to see because sometimes we are worried that patient sick to nahi hai CCU mein. But once you open the mobile, you find a good morning, a cup of tea and samosa. मैंने कहा यार अभी सोओगे तभी तो good morning होगी तुम्हारी. I think we are misusing these platforms.
There's another thing that I would exhort all our friends at Futurisk is to get up in the morning and do some exercise. So
Yeah.
many of us get up in the morning, put an alarm for 5 o'clock or 6 o'clock, and then reach out, put the alarm off, and go back to sleep. That
Snoozing is
little,
the first thing.
I'll just
Yes.
request to
Which
read an
is-
article in today's Times of India. There is a column called Speaking Tree.
That's right.
Speaking.
Just
Okay.
read that article. That is an article between, I think, Steve Jobs and Zuckerberg.
That's right.
It's a wonderful writing article. It really opens your eyes also. So keep reading good literature. There is a very good book. It's a very 50-page book called Straight Thoughts. I just bought it. I thought, let us see. And they keep evolving your thoughts also. So good literature is very important to read rather than, see, if you read junk, you are going to be junk mind.
True.
So I think this is what is very important. I think schools curriculum should have a healthy lifestyle, healthy living, rather than a competition and then suicides at Kota and IITs and AIMS and medical colleges. I think we are killing their childhood and adolescence both.
Also, I think with the trend of quick commerce, we are all getting into the trap of it, like Swiggy, Zomato.
Yeah,
It's the easiest thing for the person to, neglect their health.
very right.
And
And
more
I
than that,
have another. Yeah, please, Mr. Go forward.
Hello?
Yeah.
No, no,
Yes.
you can ask the question. Go forward. All right. Meanwhile, I would like to ask a question. What are the specific symptoms that might indicate a heart problem? that, people often overlook? Is there any early signs?
Yeah, so, I mean, how to know about the symptoms of heart disease?
Yes.
Yeah, so very
Is there
important.
any
See,
notable?
commonest mistake people do is heart and gas. Is it a gastric or it's a heart? So very simple is that anybody who has a chest pain, both side of chest pain and going to the lower jaw, going to back and going to both arms, having sweating, having unexplained feeling of indigestion. There is no reason for feeling bloated chest, I mean abdomen indigestion. There is sweating, there is perspiration, feeling a profound weakness, and you just can't walk few steps. I think you must consult a doctor. And even if you think of having a gastric pain or gas or something like that, there is no harm going to ER and getting an ECG. Let the doctor say that it is not a heart attack. You should not diagnose your heart disease. Commonest mistake people do is they come so late after 24, 48 hours. By the time they reach hospital, they are already damaged to their heart. So very important is to recognize the symptoms earliest, report to the ER or doctor earliest, and get the timely ECG. And there are certain blood markers like troponin I or trop I or trop CPKMB. I think if they are done in a timely fashion manner, in medical manner, I think that is what is going to change the game for that patient. So gastric and heart disease, they mimic, must go to hospital. Let the doctor do an ECG, some blood test, and he says that it is a gastric pain. I think you should be relieved.
Thank you, doctor. Is there any link between blood pressure and heart issues?
Yeah, yes, direct link. See, their cause. See, hypertension is a commonest cause for heart disease. In India, almost 25 to 30% deaths are hypertensive. And it is, I think, one of the commonest reason for heart disease. Higher pressure means your heart is working at higher demand, higher heart rate and higher blood pressure. See, if it has to work at 120 by 80 millimeter mercury for 70 years, by working on 180 and 110 blood pressure, it will work for 40 years. So it's just a clear mathematics actually. So a good blood pressure will relieve the pressure on organ and heart, and it will have very good heart health. So maintaining good blood pressure is a key to prevent heart disease.
Right. If one has a high blood pressure, what are the steps that they need to take immediately to, avoid any health issues?
I didn't get your question actually. I think net is not good.
And I would, is it better now?
Yeah.
Yeah. So I'm trying to ask, if one has a high blood pressure, what are
Yeah.
the immediate steps that they need to take to, avoid any kind of a mishap?
Single reading of blood pressure, and if there is some circumstances like stress, I think we should monitor. But multiple readings which are high on blood pressure, so we should be on medication as early as possible. There are certain stage like stage one heart hypertension, and when there is no other risk factors, like somebody is just having high pressure, which is not very high, say 150 by 90, but his other risk factors are maintained, then one can try for 4 to 6 weeks of lifestyle changes by avoiding diet and alcohol and physical exercise and I think yoga, pranaya. But a patient is having high pressure with diabetes, with dyslipidemia, with kidney dysfunction, I think they should seek earliest medical advice to prevent continuous damage. So it depends on how the pressure is. Is it alone hypertension or it is accompanied by other risk factors? And are there any target organ involvement? And commonest are your brain, eyes, heart, kidney. So if there is no target involvement, no risk factors, just blood pressure, you can have some time to, I think, modulate and modify your lifestyle to bring it down by. But very high pressure, I think we must start medicines as early as possible.
Thank you so much, doctor. One last question from my side. What are the benefits of regular health checkup and how often should we get ourselves checked?
Preventive health checks worldwide, they advise preventive health checks should be beyond 35 years of age. But in Indian setup, the WHO says that screening should be early, maybe at the age of 25 years. So again, there is no fixed guidelines, but we have to look at the risk population. If somebody has a strong background, genetic background of any disease or heart disease, I think they should be screened earlier. Otherwise, we screen for at the age of 25 to 30 years of age. And when we say screening means, we should get a kidney function test, we should get a liver function test, we should get a lipid profile, sugar, HbA1c, thyroid, and a hemogram, a routine ECG, echo, ultrasound, and maybe a treadmill. If they are all normal, then no risk factor, then you can screen once in 5 years. Or if there is some abnormalities, then you can screen timely. Like many patients come with SGOT, SGPT is high, get an ultrasound, you find fatty liver. So then you have to be very specific to screen how early and how far and how many times. But overall screening, yes, 3 years or 5 years, or 1 year if patient has multiple risk factors or there is genetic background. But I think preventive health is a good concept. And we have picked up a lot of patients and before it harmed them by having their echo and their ECG and their treadmill because they're all silent killers. They don't have any symptoms apparently. So screening is very important. Preventive health is very important.
Thank you so much, Doctor, for answering all our questions so patiently. If anybody has any question or anything to say, you can please take it forward, or we can wrap the session. Right. I'd like to thank you, Dr. Anand Pandey, for sharing your
Thank you.
valuable insights on heart health. I think your knowledge and guidance have been incredibly enlightening.
Thank
And
you.
on behalf of Future Risk Insurance, I would like to thank you and our wellness partner, Seva at Home, for organizing this insightful webinar.
Thank you very much. Thank you.
We appreciate your time and expertise.
Thank you.
Thank you, Dr. Saab. Thank you, Sujita, and everybody from Futurisk. I hope you benefited from this session. Dr. Pandey, it's always such a pleasure to listen to you.
Thank you very much.
The
Thank you.
tips are so important for all of us.
Thank you.
God bless you. Thank you so much.
Thank you. Thank you.
Thank you once again, everybody.
Thank you so much, Doctor. Thank you so much.
One Futurisk, please. Thank you.
Thank you.